Acute glomerulonephritis. Definition: glomerulonephritis is the very most common case of end-stage renal disease following diabetes mellitus and hypertension. Glomerulonephritis is a type of kidney disease in which the part of your kidneys that help filter waste and fluids from the blood is damaged. Glomerulonephritis is the inflammation of a glomerule or small blood vessel in the kidney.
Glomerulonephritis is the inflammation of the parts of the kidneys that is responsible for the filtration of the blood. It can be caused by a number of medical conditions that result in damage and therefore the inability of the body to get rid of waste products and body fluid. Sometimes the damage is so bad that it stops working completely and then is termed renal failure. The disease presents in acute and chronic manners. In the acute form, the onset is sudden, but in the chronic form, symptoms develop slowly over many years and usually produce no symptoms until there is severe disease and sometimes irreversible damage to your kidneys. The condition can occur in adults, but is most common in children. What are the causes of glomerulonephritis? Glomerulonephritis can start after something relatively benign like a sore throat or even a skin infection. But other illness can cause this condition. This includes systemic lupus erythematosus, Henoch-Schönlein purpura, amyloidosis, vasculitis, heavy use of non-steroidal anti-inflammatories or NSAIDs like ibuprofen and naproxen, Wegener's granulomatosis, polyarteritis nodosa, and certain degrees of immune system changes. Many times doctors are unable to figure out what exactly caused it. We just know that you have it. What are the symptoms? The mild form of glomerulonephritis usually has no symptoms. More severe disease can be present itself with discolored urine, often pink or grossly bloody or tea-colored. Foamy urine due to the excess of protein in it. Symptoms that are like drowsiness, nausea, vomiting, headaches, appetite loss, decreased urination, and sometimes even fever. The patient can wake up with a swollen face, eyelids, hands, and ankles. Other symptoms include shortness of breath, cough, high blood pressure, blistery, dry, or itchy skin. Nighttime cramps are also very common. Symptoms can last for a few weeks or even several months. Diagnosis. The doctors make the diagnosis from the medical history and urine tests that show protein and blood cells. Also blood tests and ultrasounds of the kidneys are done. Sometimes a biopsy is required to make the definitive diagnosis and to better decide the correct treatment protocol for your particular kind of glomerulonephritis. What is the treatment? In children, the recovery is much quicker, but a nephrologist will suffer from this condition and start feeling better. Don't stop taking the medications unless your doctor specifically instructs you to do so.
Applications in medicine. Plasmapheresis is a therapeutic alternative for disease in which a humoral factor has pathogenic virulence. However, it is not devoid of adverse effects.
See, I can't see if I got it. Thank you. By the machine. Sweet. This is my plasmapheresis machine I'm on, and it's hopefully going to help the relapse go away. We're praying. And it takes my spins it around somewhere, I think. It replaces it with albumin, so it's so cool. And thank you so much for helping me do it.
It's in your plasma.
Oh, cool. I'm probably going to put this on YouTube. Do you want me to get you or not? No. Okay. Didn't think so, but a lot of people say no. All right. Thank you so much. Bye.
Pros and cons.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 573, Rapid Review. What are Psammoma bodies? Psammoma bodies are a small round collection of calcium. In what conditions would you see Psammoma bodies? You would see Psammoma bodies in meningiomas, papillary thyroid carcinoma, mesothelioma, and papillary serous carcinoma of the endometrium and ovary. What lab or diagnostic finding is observed in glioblastoma multiforme? In glioblastoma multiforme, you see pseudopalisading tumor cells on brain biopsy. Define the word palisade. The word palisade in pathology means that there is a row of elongated nuclei parallel to each other. What classic lab or diagnostic finding is observed in acute glomerulonephritis? In acute glomerulonephritis, you see red blood cell casts in urine.
USMLEFasttrack.com, where we help you review the entire first.
Diseases. Glomerular diseases without self-proliferation or nephritic presentations. Membranous nephropathy, glomerulosclerosis, chronic promise renal, post-streptococcal glomerulonephritis, lupus erythematosus, or systemic vasculitis.
Hi, my name is George McKenzie. I'm not a doctor, but I have had a lot of kidney problems through the years, and I've learned a lot about the different types of kidney disorders. So I've created this video to help anyone who may suspect they're developing a kidney problem and would like to learn a little bit more about this topic. Chronic kidney disease stages define the progression of a serious and potentially life-threatening kidney problem, chronic kidney disease, or CKD. Chronic kidney disease stages range from stage 1 to stage 5. The higher the number of the stage, the greater the progression of the disease. Chronic kidney disease is a progressive condition that develops over an extended period of time. It can be decades before symptoms begin to present themselves. By the time symptoms are noticeable, a large percentage of kidney tissue may have been destroyed. There are many possible reasons behind such damage. Chronic kidney disease stages are useful diagnostic tools for doctors who can treat their patients based on the stage their kidney disease has reached. Doctors use a measurement called the GFR to determine how efficiently your kidneys are functioning. GFR is an important factor in determining chronic kidney disease stages. Stage 1. Damage at this stage is regarded as mild. A GFR of 90 to 100 is typical. At stage 1, you won't even know there's a problem, and it's likely there will be no symptoms. At stage 2, filtration rate is lower, ranging from approximately 60 to 89. You probably still won't have any symptoms, but kidney function tests would begin to detect abnormal protein levels in the urine. Now, admittedly, most people don't pay much attention to the texture of their urine, but when there's more protein than normal, it will sometimes look foamy, seriously compromised. Stage 5. This stage is critical, and kidney failure is imminent if it hasn't already occurred. Symptoms of chronic kidney disease are obvious and may include nausea, vomiting, noticeable swelling and bloating, and almost no urine production. At stage 5, the kidneys have basically stopped working, and patients would either need kidney dialysis or a kidney transplant just to survive. Chronic kidney disease is often discovered by accident because your doctor is treating you for some other disorder. Individuals with hypertension or high blood pressure or diabetes are often more prone to develop chronic kidney disease than those who don't have these conditions. So your doctor may want to run kidney function tests if you have hypertension or diabetes. There are also certain risk factors connected to chronic kidney disease. If you smoke, if you're obese, or you are more than 65 years old, your chances of developing CKD are higher. CKD is also more prevalent in certain demographic groups, especially African Americans, American Indians, or Asian Americans. Finally, you should be vigilant if you have a family history of kidney problems. When CKD is diagnosed in the early stages, mainly stages 1 and 2, the progress of the disease can be slowed with medications and lifestyle changes. In many cases, however, it's impossible to reverse significant damage to kidney tissue that has already taken place. This video was created to give those who are not medically trained a basic understanding of this topic. Here are 2 books that offer additional in-depth information about kidney health. Click on the links in the YouTube.
Glomerulonephritis. Renal involvement in systemic lupus can present with proteinuria, nephrotic syndrome, or with an acute nephritis. It is rarely the first manifestation of systemic lupus, but usually occurs within 5 years and may be the first presentation leading to a definite diagnosis.
Lupus is a disease in which your immune system attacks the tissues in your own body. Your immune system is made up of white blood cells that defend your body against foreign invaders. Normally, when foreign invaders, such as viruses and bacteria, get into your body, some of your white blood cells identify them as foreign because they contain substances called antigens. This recognition causes some of your white blood cells to make chemical markers called antibodies. These antibodies attach to the antigens, marking the foreign invaders as targets for your immune system to destroy them. In an autoimmune disease such as lupus, your white blood cells mistakenly make antibodies to mark some of your own body's cells and circulating chemicals for destruction. When the antibodies attach to your normal cells, your white blood cells begin to attack them as if they were foreign antigens. Over time, this autoimmune response causes inflammation in the parts of your body wherever this attack is happening. Inflammation makes the blood vessels in the affected area expand and leak fluid, causing redness and swelling. The symptoms of lupus happen as your immune system begins to attack different areas of your body. You may develop a butterfly-shaped skin rash on your cheeks and nose. Small sores or ulcers may form inside your nose or mouth. You may develop arthritis, in which your joints become inflamed and swollen. When your fingers are cold, they may turn a blue or white color. This is called Raynaud's phenomenon. You may have pain during deep breathing caused by pleurisy, a condition in which the outer lining of your lungs is inflamed. Your white blood cells may create antibodies that attach to bits of your DNA from worn-out cells. The attached pair, called an immune complex, can lodge in your kidneys and cause inflammation. This disorder is called lupus nephritis. Flare-ups of any of your symptoms, even those not related to your skin, may be caused by an unusual reaction to sunlight called photosensitivity. Other common symptoms of lupus include extreme fatigue, headaches, fever, a reduced number of red blood cells in your blood called anemia, swelling of your legs, feet, hands, or skin around your eyes, muscle pain and weakness, and hair loss. Lupus is sometimes called the great imitator because its many symptoms are found in other health problems. There is no cure for lupus. However, you may prevent or reduce flare-ups by avoiding direct sunlight and wearing sunscreen outside. The sunscreen should have a sun protection factor of 55 or greater and block both ultraviolet A and ultraviolet B radiation. To treat your symptoms, your doctor may recommend a combination of drugs to reduce inflammation, such as nonsteroidal anti-inflammatory drugs, or NSAIDs, and anti-malarial drugs. Your doctor may also recommend drugs that suppress or prevent your immune system from attacking the tissues in your body, such as corticosteroids.